And we'll just take them in the order they've come in. And this will be, could the CLL cell's preference for lipids be used to improve drug targeting to these cells?
That's the $1 million question, isn't it? I think it can, but we just need to figure out what that mechanism is. We know how exercise and diet can affect lipid metabolism in most tissues. Figuring it out in CLL cells should actually be relatively straightforward, but then testing what that mechanism is to find the druggable target, to find what the exercise pill is, I think it's possible.
Okay, well, thank you for that. And we have a question with regard to the use of statins. Does the use of statins have a positive impact?
So there is some data out there, and it was published as an abstract at an ASH conference a couple of years ago that showed that patients who were taking statins had better outcomes than patients who weren't. And obviously, statins work through reducing your cholesterol and reducing some of these lipid mediators. And so obviously in the treatment naive patients where the CLL cells are acquiring those lipids, it seems like the statins were having an effect. Now, I haven't seen any of the follow-up data from those abstracts yet, but the mechanism should be similar. And so yes, so statins should have an effect, but we need to see the data before we can confirm that.
Okay, thank you. Maybe the next one is for Ellie. It's from Michael, and he says that he considers himself above average active stroke fitness. He's a 59-year-old and he's had CLL for 10 years, but he asks, where can he get dietary advice?
Like David mentioned in his talk, there's actually currently no advice on or guidelines on dietary effects in CLL. So what I would do is I'd go to the NHS website and look for the recommended guidelines for just the general population at the moment. Just try and eat healthily before any other until we get some more research into the dietary advice.
Okay, and I'll keep you on mic at the moment then, Ellie. And this attendee says that they ran half marathons before diagnosis, and they're currently on active monitoring, but clearly suffering from fatigue. And that's a very common symptom of CLL that we're aware of. The person has little or no energy to run any distance, and any advice would be appreciated.
So the key thing for someone who's suffering from fatigue is to start at a level that doesn't create you fatigue or doesn't cause fatigue. So whether that be walking, and then maybe slightly jogging if you feel you've got the capability to, and then over time, again going back to this progressive overload, sort of test the waters, see if you can progress a little bit more, and see if it doesn't cause you too much fatigue after. And over time, hopefully you will be able to get back up to that level that you were before. Maybe not running marathons, but definitely being able to have a go at a run. But it is, again, stripping it right back and slowly, progressively overloading. And it may take you that extra longer than someone who's not suffering fatigue. But again, progressive overload, but really, really small little increments up to see if it does trigger fatigue or not.
Good practical advice there. Thank you.
Can I just add one thing to that, Ellie? Excellent answer to that. The one thing that we do know about fatigue is that fatigue comes in kind of waves, and so a lot of people feel their fatigue at different times, and sometimes it's got a pattern, and sometimes it doesn't. If you do suffer particularly bad fatigue, it's trying to figure out when you're not feeling your worst fatigue, and it's at that point that you should try to aim for your exercise to happen. Hopefully it's not like midnight. Hopefully it's sometime during the day, but trying to figure out when the fatigue is lowest severity is when you start to do your exercise.
That's a really interesting perspective, David, and I had considered that. And I know from talking to others how debilitating and also physically debilitating, but also mentally exhausting fatigue can be. So having those little opportunities to combat fatigue is vital. Question here is, and it, whichever one of you want to answer it, please do. How do you work towards progressive overload when you also have osteoarthritis, thinking specifically about the knees and the hips?
So with osteoarthritis, the key thing is to make sure the exercise isn't causing you pain in those areas. But two, you need to build muscle around those areas to help with the osteoarthritis and the pain that you are experiencing. So again, it's starting off maybe with some, definitely low impact exercises such as swimming, or chair exercises, or Pilates is a really good one for someone who's suffering with osteoarthritis. And there are a lot of Pilates instructors out there who will be qualified to work with people who have osteoarthritis, and then again find a level that's not causing you pain, and then slowly progressing as you build up muscle and build up fitness. David, do you have anything else to add?
Yeah, sure. So there is physical activity guidelines for people with osteoarthritis as well, and the majority of the data suggests that it is safe and doesn't cause any additional worsening of the arthritis. And what we know, so another disease that my lab looks at is rheumatoid arthritis, and so we've trained many patients with rheumatoid arthritis as well in a similar sort of pattern to what we train the CLL population. And what we find is that we're not causing any additional damage. We're actually strengthening the muscle and the immune system that are probably causing some of the inflammatory factors in there. But it's very heterogeneous. You know, there's so much osteoarthritis out there that every single patient's different. So it has to be a personalized approach. But it's possible. You just need to get the right advice or the right trainer.
Good, thank you both. I'm smiling at the next question because I promise I haven't planted it. Some of you may be aware of the article I wrote in a recent newsletter on psychology, from my own personal take on the physical and mental benefits of cycling. So the question is, and it's specifically asked to you, Ellie, so you have a little bit of time off for good behavior here, David. Ellie, would you equate 30 minutes use of an exercise bike in a gym to 30 minutes normal bicycle in everyday use? How do you factor the additional benefits of the gym of life cycle exercise in terms of fresh air and well-being benefits, better off financially too, using a cycle to get around rather than driving to a gym?
So definitely, if you can get outside, like you mentioned, John, it's very important probably to get outside and experience nature. The only thing that is slightly different with an exercise using a normal bike versus a exercise bike outside is, an exercise bike inside, is that an exercise bike inside, you can monitor exactly what intensity you're working at, and you can maintain that intensity throughout the set amount of time. If you're cycling outside, it's a little bit more difficult to do that because you've got the terrain, you've got traffic if you're cycling on a road, but as long as you're focusing on that intensity, those RPE scales in terms of getting your heart rate up, getting hot, getting sweaty, then you're doing yourself some good. So they do equate to one another. Just the bike inside is a lot easier to monitor the intensity you're working at versus outside.
Thank you. Anything to add, David?
Nothing to add on. That's exactly what I would say. Yep.
I'll add my 2p worth in here, and I'm not quite sure it's financially better, because if you subscribe to the ideal number of bikes is n+1, well, then it can get very expensive. From the point of view of monitoring, though, there's always the famous Strava app, and you can at least begin to track your progress and see if you do a repeat route, then you either get faster at it or whatever. Okay, next question. Is it okay just to do moderate exercise rather than vigorous?
Yes, yes, it is. Simple answer is yes. Moderate exercise, you may just find that it takes you a little bit longer to see any major fitness changes within your body, but you will get there. So moderate exercise will still give you the same benefits, just may take you a little bit longer.
Okay.
I'm going to disagree with Ellie on that one.
Oh.
Sorry, Ellie.
That's fine.
Fundamentally, I think you're right. It is okay just to do it, and it will probably take you a bit longer. But you have to think of the body as an energy house, and to train the different ways that you deal with energy requires different types of energetics, and so that means different types of exercise intensities. And when we think of athletes, and we think of elite athletes in particular, they'll have sessions where they're working really hard for one session, sessions where they're working really easily for another, sessions where they're working in the middle, all designed to maximize the impact on their whole body energy metabolism. And so exercise in my opinion, and a couple of others, should be prescribed in a non-linear approach where you do bits of hard exercise, bits of easy exercise, and bits of moderate intensity exercise to get the best benefits. But that said, if you just did moderate intensity, you'd still get good benefits. But if you want to be the best of the best and run those half marathons, then work the hard bits and work the low bits as well.
Good. Okay. Next question. What is your opinion of parkrun?
Great.
That's good.
I think it's great. It's a great social event. You can go run with people, your time's tracked, so you've got something measurable in terms of seeing if you can beat your score week on week. So I think it's great.
Yep. Yeah, I totally agree.
Okay, good. And this person said, I already do training with a personal trainer twice a week. How could that fit in with the study?
So Alex, who spoke earlier, actually did the whole intervention under his personal trainer. So I sat down with the personal trainer and took them through the intervention and jumped in on a couple of sessions with them, and so it's doable if you're happy to pay for something that we provide. In terms of if you're wanting to do your personal training sessions outside this our intervention, becomes a little bit more difficult, because then it's when do you have that day of rest, or when are you allowing your muscles to recover. But it's something that we can talk about, and we can manage and monitor and discuss later if it's something that you do want to do.
I'll actually weld another question, which is later down the list, to this. And this person asks, and I was confident this type of question would be asked, how could we assist with the research without traveling to Surrey?
Yeah, so when I first got back to Surrey, we were really hoping to try and bring in a program where it was much more community based and nobody would have to come here. It turns out I'm having a lot more difficulty than I thought I would with getting ethical approval to do that kind of study. So we're still working on figuring that one out. And once we do, then we'll put it out there as a community-based program. I wonder, at the moment, I'm wondering whether we just make it like a community group thing where people tell us some of their fitness markers and how they're progressing, and we give advice. But at the end of the day, my university thinks that I'm still responsible for everybody's safety. So at the moment, we're not going to be there anytime soon, I don't think.
Okay.
If that
maybe this is something we could talk about with within our hosting capabilities, but let's not make any promises live on air. One person says that they used to go to the gym, but now avoid places like that because of the fear of COVID. Am I being over careful? Another $64,000 question, I'm afraid.
Yeah, that is a tough one. And for sure, COVID really hit the CLL community pretty hard, especially in this long-term fear effect. And I think this person is totally right in having worries about going to a gym. If it's a good gym, then they should have some sort of COVID things in place, but a lot of them don't. You could wear your mask whilst you're exercising, and then we can figure out the exercise intensity whilst you're in your gym. But yeah, you still need to be careful. You're immunocompromised, and anytime you're in the public domain, you're always at a risk of catching one of these viral infections. So yeah, so I think you're right in trying to be careful when you're in and around that area.
But to just add to that, you can do so much still at home. So you don't need to go to a gym to be able to see the benefits of jumping on, walking outside, or buying some bands, or just moving in general. So you can still do a lot at home.
Thank you both for that practical advice. When fatigue is caused by anemia, what is your advice regarding exercise? And we know our members have suffered with anemia and low hemoglobin counts.
You want me to go for this one, Ellie?
Yes, sorry.
Sure, yeah. Yeah, it's a tough one. CLL mediated anemia is a tough one. And so the fatigue that's in there is pretty prominent and pretty devastating at times. But similar to the fatigue question I had earlier, it's about getting the right timing, taking it slowly so that you're not creating fatigue. But it's a longer journey when you have CLL influenced anemia, because there's no real cure for it at the moment. And we know that exercise can help hemoglobin levels and red blood cell levels, but in CLL it takes a heck of a lot longer. And so it's a case of getting on the bus with the exercise program and then sticking it out. The benefits will eventually get there. It's just going to take a lot longer.
Well, we've actually come to the end. Oh, I thought I did. Aha. Classic scroll down to the end of the page. I go to a gym and do 2 45-minute strength training classes, 2 1-hour yoga, 2 1-hour Pilates, and a 45-minute aqua aerobics class weekly. Do I need to think about incorporating a HIIT session too? I think I need to sit down and have a relax after that.
So going back to the physical activity guidelines that we've got, which is 150 minutes of moderate intensity activity and 150 to 300 minutes of moderate, 75 to 150 of vigorous. From that, you're probably not getting that much moderate in. You're probably getting a lot of resistance stuff in, which is great. Moderate intensity to vigorous, probably not so much. So yes, it's probably wise to start thinking about incorporating some more aerobic style training, but you already do so much. So it may be a case of swapping one in and out if you feel like it's something you want to do. But David, do you have anything to add on that?
No, I totally agree. I think it sounds like you're totally right. It sounds like it's quite resistance, and the Pilates is quite resistance based as well, you know, using your own body weight. So it's quite resistance heavy. And really that's great for physical function and strength, but you still need cardiorespiratory fitness to be up there as well. And a simple way to test it is to jump on one of the treadmills at your gym and do one of the fitness tests and see what it comes back and says your value was for your age group. And then you can start to tell there whether you're a little bit lower or a little bit higher than the normative data.
I will close off by saying thank you very much and wish you all a happy Christmas. Take care.
Thanks, John.
Thank you.